Hello all, welcome to today's topic, Vitamin E. Myself Dr. Surekha, lecturer, Department of Biochemistry, SRM Dental College, Ramapuram. In this lecture, we're going to see what is vitamin E, what is its sources, RDA, and absorption of vitamin E, followed by the biochemical functions and deficiency manifestation. So let's enter into the lecture now. So tocopherol, which is considered to be a natural antioxidant, which is mainly involved in the reproductive function. That's why it is called as anti-sterility vitamin. The vitamin tocopherol, which is mainly helps in promoting the fertility of the individual, both male and female. That's why it is called anti-sterility vitamin. There are many forms available in the nature. Here are the various forms of vitamin E, the tocopherol alpha, tocopherol beta, tocopherol gamma, and tocopherol delta. The structure of each form will be shown in the next slide. So the structure of vitamin E is mentioned here. The alpha tocopherol is most active and predominant form among other structures of vitamin E. Coming to the sources of vitamin E is widely distributed in all the oil contents. Say, for example, the coconut oil, olive oil, corn oil, groundnut oil, sunflower oil. So, all the seed oil will be having especially an increased amount of vitamin E. Vitamin E is not only present in the oils, it is also widely distributed in fruits, vegetables, and nuts. Here are some of the sources of vitamin E. So, vitamin E is found in broccoli, spinach, tomato, sweet potato, avocado, mango, kiwi, apricot. These are some of the fruits and vegetable sources of vitamin E. Also, vitamin E found to be present in almonds, sunflower. That's why the almond oil, sunflower oil, peanut oil do have a vitamin E in it. So they are the rich source of vitamin E. Hazelnut, also pine nuts, they do have a vitamin E in it. Not only the fruits, vegetables, vitamin E also present in the peanut butter, almond milk, tomato sauce, because the tomato is a important source of vitamin E. So when we make sauce using tomato, the tomato sauce will also be having vitamin E. So these are some of the sources of vitamin E. The other important source of vitamin E is eggs and dairy products. Also, vitamin E is found to be present in the seafoods like fish, prawn, crab, and all will have some amount of vitamin E in it. So now let's see the recommended dietary allowance of vitamin E. Male is advised to have a 10 milligram per day of vitamin E. Same way the female is advised to have 8 milligram of vitamin E per day. The pregnancy women is advised to have 10 milligram per day of vitamin E. The lactating mother is advised to have 12 milligram per day of vitamin E. So 15 milligram of vitamin E is equal to 13 international units. So this slide shows the vitamin E absorption and transport. So after dietary consumption of vitamin E, it is absorbed in the duodenum along with the other lipids. After absorption, it will be transported to the liver through chylomicron. In the liver and the adipose tissue, the vitamin E can be stored or it can be utilized for a biochemical function. The major biochemical functions of vitamin E is listed in this slide. As I was discussing, the vitamin E serves as a powerful antioxidant by scavenging the free radical generation. Also, it helps in protecting the cell membrane. By protecting the cell membrane, the functional integrity of the cell will also be preserved. It also helps in protecting LDL from oxidation and double bond of polyunsaturated fatty acid from oxidation. It also helps in preventing the rancidity, and it works with selenium in preventing all the major reactions which produces free radicals. So this slide shows the action of vitamin E, that is alpha tocopherol, which is an active and predominant form of vitamin E. So whenever this antioxidant encounters the free radical. Here the peroxy radical is given as an example. So whenever the free radical is generated in the system, the vitamin E comes into play just by donating some of the electrons from the vitamin E to the peroxy radical. So the singlet oxygen or your unpaired electrons in the peroxy radical will be neutralized or will be paired and will be converted to lipid hydroperoxide. Upon donation of some of the electrons, the vitamin E will be converted to vitamin E radical. This vitamin E radical will be converted back to alpha tocopherol or active form of vitamin by the vitamin called vitamin C. Here is a picture showing the free radical scavenging action of vitamin E. So this is the lipid bilayer, and this here you have a free radical. So these are all the free radical which tend to oxidize some of the phospholipids present in the lipid bilayer. So the action of vitamin E is to scavenge these free radicals. So they just donate some of the electrons from the vitamin E to the unpaired free radicals. So all the radical will be paired, so it will be neutralized. These are the neutralized free radicals. So here see, can you see the vitamins E here? All the free radicals are neutralized with the help of vitamin E by donating some of the electrons to neutralize its unpaired electron present in their structure. So the vitamin E helps in scavenging the free radical just by donating the electrons. So the neutralized free radical will not cause further damage to the lipid bilayer. Vitamin E also helps in protecting the RBC from oxidants and helps in preventing hemolysis. Also, vitamin E plays an important role in reproduction by maintaining and preserving the germinal epithelium of gonads. It helps in the preservation of the normal reproduction of animals. Hence, it is called anti-sterility vitamin because it helps in preventing the infertility in the animals. In the human, it is unknown. It is also called anti-atherogenic vitamin because it protects the LDL lipooxidation from oxidation because the oxidized LDL is more atherogenic. So the vitamin helps in reducing the risk of atherosclerosis. Thus, it is called as anti-atherogenic vitamin. Also, the vitamin helps in boosting the immune response. It helps to slow down the process of aging. It also required for the cellular respiration to facilitate electron transport chain. Some of the amino acid absorption is favored by vitamin E presence. Also, it is involved in the proper synthesis of nucleic acid and for the proper hair growth with the biotin vitamin E is also required. This is the commercially available vitamin E capsule, which helps to maintain the skin, hair, and lips of our body. So each capsule will be containing 400 milligram of vitamin E, which serves a beneficial effect for our skin and hair. This slide shows the overall fate of vitamin E from the source to the destination. So as I was discussing, the plant source such as fruits, vegetables, and seed oil, nuts and seeds, they do have a richest amount of vitamin E than the animal source. So upon consumption of vitamin E, it will be digested and absorbed in the duodenum of small intestine. From the small intestine, it is carried by a chylomicron to the liver and adipose tissue. Once it is carried to the liver and adipose tissue, it can be stored or it can be utilized for the biochemical function. The most important function of vitamin E is antioxidant function. It acts as a antioxidant against free radical generation. So the cell membrane integrity is preserved. Also, it helps in preventing the DNA and also it helps in it helps in preventing the atherosclerosis in the heart. Also, it helps in preventing some of the free radical action in certain tissues like lung tissue and other tissues. Some of the deficiency manifestation of vitamin E is listed in this slide. The number one is hemolytic anemia, because the vitamin E is essential for maintaining the RBC cell membrane integrity and function. Deficiency of vitamin E leads to hemolysis, causes hemolytic anemia. The number two is retrolental fibroplasia, which is always seen in the low birth weight infants. So it is always associated with the neuropathy. The creatinuria is one of the other cause of vitamin E deficiency. So the muscular weakness and dystrophy, which involves in the creatinuria, which is mainly due to the deficiency of vitamin E. Neurological disorders, degeneration of the liver, nocturnal muscle cramps also associated with the vitamin E deficiency. In animals, it results in permanent sterility in male rats. Resorption in fetus is seen in the female rats. Hypervitaminosis, which means excess of vitamin E accumulation causes hypervitaminosis. So it does not seem to have any toxic effect. However, some of the symptoms like hemorrhage and neurological symptoms can be occur due to hypervitaminosis B. So with this, I'm ending the lecture. Thank you.